Okay, in this video, we're talking about the Titleist Performance Institute pelvic rotation test. What is the pelvic rotation test? Why do we do it? And what is it test for? And then if we are struggling with it, what are some things that we can do to help improve it and then integrate that back into our golf swing? So what is TPI's pelvic rotation test? Here it is. First thing you do, stand like you're holding a 5-iron. It could be a 6-iron. Just imagine you're holding a 5-iron. We'll call it 5-iron posture. Slide bend the knees, little hinge, whatever that looks like for you. Then your hands go on your shoulders. Now here's the key. I want to rotate side to side. Head and trunk are glued in place. They're not allowed to move. It's just the belt buckle and the pelvis that is rotating side to side. Okay, so what we want to see here is that you can maintain your trunk position while rotating the pelvis left and right. It should be smooth. It should be relatively easy. You should be able to, without too much effort, control what's happening here while moving what's happening here. From the front, belt buckle rotates left and right. Smooth, relatively easy, without too much lateral sway, so it's not this. And from the side, we don't want the knees coming with you like this, okay? So it has to be hip and pelvis moving independently of what's happening here at the trunk and below, okay? So there's no lateral sway. We're not allowed to extend at the hips, and we're not allowed to let the trunk come with it. So make sure that you're checking, because sometimes you don't even feel it happening, and then you see that the trunk and belly button are moving with your pelvis. What we're testing for here is, can we separate the pelvis from the trunk? Really important for golfers that they have such great control over the pelvis and what the pelvis is up to. So we also test pelvic tilt forward and backwards to test, do we have control in that plane of motion at the pelvis as well? But in this case, again, we're testing for rotation. If we take the backswing and we get to the top of the backswing, TPI has found the best golfers in the world, what they're able to do is create a little bit of initiation, a little bit of a lateral shift, but also this turn that happens that creates this extra stretch. You can see it on my shirt here between pelvis and trunk. So this pelvis has to be able to rotate without the sternum coming with it. A lot of folks that really struggle with this motion here, they get to the top of the backswing, the first thing you want to do is bring arms forward. Everything kind of comes down together. When these two things are connected, we tend to have that over the top swing plane. Okay, naturally, if we separate here, we actually do a little bit better of staying on plane. Besides that, we get to utilize stretch shortening cycle and other characteristics of the muscles here to create a little bit more speed and power in the golf swing. And then again, with the sequencing, it is just a natural and great transition of directions, but also a way we translate force and turn into speed and power, right? So if we can turn one without the other, we get stretch shortening cycle, and then we're able to create stability here and now drive this side into rotation. We have a side to pull from, we have a place to pull towards, and we can use that as a stable base to rotate the trunk on top of it. So that's why we test for the pelvic rotation test. We want to know, can you control the pelvis, can you control the trunk, and can you separate these two independently of each other? Now, to be really good at this, we need a few things. We need mobility in certain spots, and we need stability and motor control. So what do we need? We need hip internal and external rotation. So if we're not allowed to move everything together, then this pelvis needs to be able to rotate while this femur stays stable. It's the same thing as rotating a femur on a stable pelvis, right? The joint needs to be able to experience internal and external rotation smoothly and easily. So we need hip mobility. We also need trunk mobility. If this is a problem, well, this rotation gets more extreme if this starts to move independent of it. I'm essentially in even more rotation here than I was before. So we want to be really comfortable through trunk rotation, spine rotation, and flexion and extension. So we need mobility here and mobility here. Well, if we're going to move this independent of this, we also need to be stable or have good motor control over the pelvis, right? We need to be able to control it. We need to be able to tell it to move. So we need good stability, strength, and motor control at the pelvis on top of that mobility. And it's the same thing for the trunk. Can we stabilize here, move independently? If this is weak, or we don't have good control over it, and we can't separate these two things, well, this starts to come along for the right. So we need to be strong here at the core. That's why we test this in this position. Can we be strong enough here to stabilize it without moving it with the pelvis? So mobility, stability, motor control, mobility, stability, motor control. We also need the ability to create these forces and these motions, and that comes from the ground. So where you're putting forces and pressure down into the ground. As we turn into one side, this foot is kind of experiencing some supination. So without letting the foot cheat and come off the ground, that arch should feel like it's almost coming up. So as we turn into this, we get a little bit of supination through the foot. It's allowing us to rotate into that side. And then we want to press it down in a way to rotate back towards the left. And so it's subtle, but there's a little bit of supination and pronation that will happen with the foot, or just overall grounding. Can you feel the feet in the ground? Can you put pressure through the ground to move the joints above it? So having a good understanding of supination and pronation at the foot, a little bit of mobility, but also just generating force and understanding pressure. These are the things that we need to be really good at the pelvic rotation test. Okay, so let's start with this. Let's do some hip mobility training. Then from there, we'll go into some trunk stability. We'll do some foot grounding and foot pressure stuff. But for the most part, these next few movements, let's focus specifically on hip mobility training. Okay, for this next drill, what we're trying to do is create or change the orientation of the pelvis and then get true hip motion on a kind of neutral pelvis and rib cage. So to do this drill, what we need is a wall that we can place our feet up on. What I want you to do here is drag your feet straight down, but let the friction of your shoes or your feet keep them on the wall. This should just activate your hamstrings a little bit. You can think about driving them down. We use that hamstring activation to lift our pelvis up or peel. Think about peeling your sacrum off the floor. We don't want to go super high up, just an inch or two off the ground. Your low back should still be flat to the floor. From here, we need to work on our breathing. So the breathing sequence for this is in through the nose, out through the mouth. And when you're inhaling, it's nice and slow. Think 5 seconds. As you're exhaling, another 6 seconds out through your mouth like you're fogging a mirror. The reason why we do it like that is that helps turn on your obliques. So you'll notice when you're pushing out every last bit of air right at the very end, that last 10 to 5%, when you're breathing out through your mouth like that, is it will shoot your obliques on, and we'll get less rectus abdominis. We don't want to crunch like this. We want to pull these ribs down and in by using our obliques to do that, and this is the best way to do it. So in through the nose, out through the mouth. We'll pull our hips back up. We're going to place a ball right here, and we're just going to breathe. Now, where we can progress this is we can start to swivel our hips. So think one hip down, one hip up. And we want to limit how much side to side motion we're getting at the hips. We don't want this. We want to just drive one hip down, one hip up, and then exact opposite. Maintaining this peeled sacrum off the floor position, so hamstrings are still on a little bit. Pelvis is in a neutral position. We're tucking our rib cage down by breathing in through our nose and out through our mouth. I want you to hold some of that oblique tension as you exhale. Once you get all the way at the end and your obliques are on, hold that contraction, breathe back in through your nose, and just maintain that sequence as you swivel forward and back. Think about pushing this knee as high as you can, driving this knee as deep as you can into that hip, and then doing the exact opposite. A key here is that your feet have to stay flat to the wall the whole time. Can't let a heel pop up or your toes start to pop up, anything like that. Then we're getting not motion at the hips. It'll come in from the foot instead, right? So that has to stay firmly planted on the wall, and then we're just swiveling through there, getting good true hip motion on a neutral pelvis. This is our DNS modified oblique position. So the starting position here, bottom side hip is at 90 degrees. I like the knee at 90 degrees as well. Top side leg is straight. And then we're going to be up tall on our elbows here. So a common mistake is that we get kind of slunched or hunched down over our elbows and forearms. I want you to think stay as long as you can through your arms here. Essentially get your chest as far away from the table as you can, keeping both elbows and forearms down. So we're not here, but we're up tall. From here, we're going to hold this position where I push knee down into the table, which lifts this bottom hip up just an inch or two, and we're just going to hang out here and hold, again staying tall and away from the table. I want it to feel like your shoulder blades are kind of pushed out and around towards the edge of your back. Stay tall, push through the table, pushing knee into the table, hips high. We should feel a lot of action here on that bottom side hip. We're just going to hang out here and hold. Breathing should be 360 degrees through the waist here. So I want you to feel like you're breathing into your belt line, 360 degrees in through your nose, slow. Once you get a big inhale, I want you to try to maintain all that expansion you've just created even as you exhale. It's hard to do, but feel like After you've expanded 360 degrees here, you're kind of keeping that outward pressure even as you exhale. So we get some oblique and abdominal action through that. What we can do at the end here, after holding for maybe 20, 25, 30 seconds, is staying up. We're going to pivot on that shoulder, reaching up, 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 staying strong through that shoulder, keeping our hip up off the ground, and working through like that. Something to consider in that position is keeping the shoulder out of your ear, right? So what we don't want is, as we come up through here, is that we kind of get loose through here like this, as opposed to that there. So keeping the shoulder away from your ear, okay? Don't let it kind of hunch. That is the modified oblique position. We do the same thing, other side. Give it a shot. Now, let's focus on trunk stability training. Again, if you want to be really good at pelvic rotation tests, we need to make sure that we're exceptionally good at being stable and maintaining stability through the trunk. These next few drills will focus on trunk stability. Okay, for our FRC thoracic spine rotation drill, what we need is something that can't move, a pipe that's relatively strong. You can use a broom handle, a thick PVC pipe, maybe even metal rod, or wouldn't use a driver. From here, we need something to block our pelvis. So we can put a block at our belt line into the wall. We can do this from a tall kneeling position, or if you have enough space, we'll bring 1 foot up. In this case, we're gonna do tall kneeling. From here, I'm gonna rotate as far as I can away. Now I have to keep this block where it is. If it starts to rotate or pivot up like that, then I know I'm rotating my pelvis and below and not just my thoracic spine. So this tells me when anything below my T-spine starts to rotate, okay? So I keep that relatively straight. I take this pipe, I rotate as far as I can. From here, get it into a position where you're staying at your maximum rotation, but that pipe is now in contact with, in this case, the box, right? So instead of coming from here and then unrotating to get that where it is, I go to max rotation, then I extend this arm to get that where it needs to be, and I can change my hand length or width, whatever I need to do to make that happen. So I'm at maximal rotation. From here, we're gonna hold for 45 seconds to a minute. So I'm gonna ramp this up from a 2. I'm pulling back, I'm essentially doing this, but into the block at a 2 out of 10. And I'm not using my arms to do it, I'm using my trunk to do it. So I'm letting it come from my obliques and my core musculature to rotate that box into it, or this pole into this box. I'm gonna ramp up from a 2 out of 10 to about a 9 out of 10, even a 10 out of 10 at that very last few seconds. So think at about the 40-second mark or the 35-second mark, you should be at that 9 or 10 out of 10 rotating into this box. Once you hit your time limit, whether it's 45 seconds or 60 seconds, and we finish that maximal contraction, then we're gonna do liftoffs. We're just gonna try to reach, get into a little bit more thoracic rotation than we did before. We're gonna hold for 5 seconds and then come back. Rotate more, hold for 5 seconds, then come back. So after each maximum or ramped hold or into the box there, that rotation into the box, then we're gonna do a liftoff. And we're actually gonna see, can we get just a little bit more than we had before? Give it a shot. Okay, this is the functional range conditioning drill from FRC. This is our thoracic CAR, so controlled articular rotation. What the drill looks like, you can have a very light medicine ball. If you don't need it, you can just kind of give yourself a hug as an alternative. But it's a big squeeze, and I'm gonna squeeze a little bit lower to avoid the mic there. A squeeze around this medicine ball, which helps get your shoulder blades out and around. It puts some length into that upper back and the tissue of the upper back. So we just get this big round squeeze and then give it like an 8 out of 10 squeeze as we do this. From here, I want you to rotate first as far as you can in one direction, then stay as rotated as you can be, but also tilt down the angle of the shoulders. And then from here, we're going to extend up and around. And from here, I'm already rotated and tilted towards the left. I'm gonna stay rotated, untilt, and then unrotate. We do the same thing, opposite direction. Rotate as far as you can, tilt down the angle of the shoulders as far as you can, extend as much as you can as we come around, untilt, unrotate, okay? And that is the functional range conditioning thoracic CAR. Okay, so 8 out of 10 squeeze, as much rotation as you possibly can, hold for a second, tilt as much as you can. The idea of this drill in this position is to really drive you to your end range controllable rotation through the thoracic spine. Go ahead, give it a shot. These next few drills now are going to focus on pelvic control. So bringing specific awareness to creating motion here at the pelvis, how we do that, where the force comes from, which muscles need to work, which muscles need to turn off. So this is some pelvic motor control and stability training. Okay, this is our supine cross connect with hip lift. So what we're doing here is our supine cross connect, which would be opposite elbow and knee reaching towards each other like this. What we like to do is put a ball or a yoga block in between, pin that yoga block, and then from here, we're just doing our normal cross connect. So hands should be kind of hovering above your head. This foot should not be out towards the midline or out towards the side. Try to keep it in line with the knee. And then from here, we're just breathing in through the nose, out through the mouth. Big long inhale, big long exhale like you're fogging a mirror. You should feel that exhale tuck and bring your ribs down, down, down. I want you to hold that tension after the exhale as these ribs tuck down and try to keep them there, holding that ab tension as you breathe back in through your nose. Again, nice and slow, slow, slow. Now, what we're doing in this variation with the hip lift is the same thing as the cross connects I just walked you through, but now this opposite side foot is flat to the floor, and we're just going to do a simple lift. So I want you to raise your pelvis and part of your low back off the ground. We're pushing through the heel of that flat foot, getting some glute activation here on my right side, and then we're holding the same position. Everything else is the same. In through the nose, out through the mouth. Holding that position. Trying to get more glute activation here than hamstring. Again, focus on trying to get that glute to do the work. And then we're just holding that position with a tuck of the pelvis. So think belt buckle towards belly button as you raise that pelvis off the ground. We're trying to stay out of this extension state at the low back and instead extension at the hip, which means we have to pull that pelvis back up and keep this position as we hold and breathe through there. That is our supine cross connect with a hip lift. Give it a shot. These are our separation kickstand turns. So what we're working on here is creating some stability here, separation here, mobility here, and then vice versa. Can we create some stability here and some separation here at the pelvis? So again, can we separate these two regions? Very important for the golf swing, and TPI Golf has even built some assessments around this to see do you have the capacity to separate these two regions because of how important it is in the golf swing. So what we're going to start with is one of my favorite positions is this kickstand position. All of the weight is in the forward leg, slight bend in this knee, and I want you to feel like you're suspending yourself up through this hip, right? It's almost like this glute just kicks on to keep the hip from kind of giving out on you, to keep you upright. All the weight is in this forward side. This is just here if we need it. From here, a slight hinge. I want you to stay as strong and long through your spine as you can as you do that. And then from here, hands go wherever you like, across the shoulders, on your hips, whatever you kind of prefer. What we're working on in this position first, and we can do it a few different ways, is let's say we want to turn the pelvis, but keep the trunk stable, right? So trunk, there's a laser on the sternum, and it stays pointing in one direction. What we'll do here is I want you to think about turning the belt buckle in towards the hip, while the trunk and the sternum stay facing home. And then turn that pelvis back the other way. Again, sternum stays pointing down. I want you to really work hard to get into your true end range here in this position. And I think this hand position here really helps keep that sternum or trunk locked down. So imagine almost like you're going down to hold the club in your hand. Really work hard to turn that pelvis as far as it'll let you, and you will feel the muscles around that hip really start to light up. We can do the same thing now with the trunk being the mobile part, but the head and the belt buckle or the pelvis stays locked into place. So for here, hands and pelvis stay in place. I just want you to turn your trunk as far as it'll let you, and then turn trunk back the other way, again, as far as it'll let you. Be careful here not to start standing up and losing your posture as you do this. Try to keep that angle at the knee and at the hips throughout. And that'll really cook or get these muscles around the pelvis working pretty dang hard. So try both versions of this drill. Work hard to get into true end range. Pull that pelvis as far as it'll let you. Open that pelvis up as far as it'll let you. And continue to adjust and fight back with the position that's supposed to be stable and unmoving. This is a great warm-up movement, but we can really take any sort of mobility and stability motor control that we've training and apply it to an upright position, golf stance position with a move like this. Give it a shot. Now let's really put some things together here with some foot grounding or stability motor control drills that force us to use pressure through the foot and use the joints above it. So we're paying attention not only what the foot's up to, but how can it stabilize, create the forces that move everything else above it, and then we can translate this back into the golf swing. Okay, for this drill here, we are working on pronation and supination of the foot, but we're going to bring some knee flexion and extension into it as well. Now, we start with our foot, with our toes hanging off a plate or any kind of raised surface like this, because it'll tell us when we start to clench the toes. When the toes start to clench down like that, the foot becomes very tense. All those muscles and tendons that help make that happen start to get taut, right? And so we take the ability to kind of move in and out of positions away from that foot. So this is feedback to say, hey, don't let the weight get into the toes, because the moment they start to work to stabilize, we've lost mobility at the foot. Okay, now this can be up against the wall, and you can kind of use the wall for support or a rig. I'm using a PVC pipe to help keep my balance. This is what the drill looks like. So it starts, if I'm using the left foot, is I'm going to bend or break at the knee, and I'm going to reach across, and I can bend my knee to help me get there. And then I start to straighten the knee a little bit as I rotate my pelvis back out towards you. We pull knee back in, and I sit and sink into that a little bit, and then I come back up through here like this. Now the key with this movement is you're not allowed to let the inside edge of the foot start to lift off the ground like that. We just lost relative motion. We want to drive in this position some supination, so you see that arch really rise back into that foot. I want you to let that happen. And then as we come back around, we feel that arch start to drop as our weight shifts towards the inside, and now we have a pronated position through here. Toes are still relaxed. As we come back through here, we're back into kind of a supinated position, and then through here the arch drops, and we're back down into a pronated position. So again, use a wall or some sort of external support to help you work through that position. But now we're really driving a weight-bearing position, some knee flexion and extension, and then some pelvic rotation on top of it to help teach the body what positions the body is in when we create a supinated position at the foot and a pronated position at the foot, right? And to keep the toes away and let the foot relax and do its job as it needs to for pronation and supination. Go ahead, give it a shot. Okay, this is a great drill. We're starting to work on creating stability and strength into our lower extremity while also working on mobility and, again, core stability through the trunk. So what we need is a relatively light plate. We can also use a kettlebell. We're going to go up onto one leg like this, slight bend in the knee, and then we're hinging at the hips. See what it looks like here. Slight bend in the knee, hinging over at the hips. What we do from here is I want us to rotate towards the downside leg and then reach out. Bring that back in and then rotate back. You'll feel this hip start to light up, trying to create stability there for you. So again, we're here, slight bend, hinging over, rotating towards that downside leg, reaching, slowly pulling it back, and then we can rotate back, maintaining that balance, right? And then we can go out and do it again. Again, you're going to feel that hip lighting up. We're also challenging thoracic rotation and strength and stability of that core as we push this weight out further and further away from us, maintaining our angles, pulling it back in, owning that position. Okay, so go ahead, give that a shot. Okay, this was the TPI pelvic rotation test. It's an important test. A lot of folks really struggle with it. There's a lot of different components to it to get right if you're going to be really good at this, and it definitely translates into becoming a better golfer. If we can start clearing this test, it's like the runway is now clear for maximal improvement in your golf swing. So if you're going to work with an instructor, if you're going to and practicing as much as you can, it's worth investing in the physical, the body. Take a look. What are you capable of doing? What's easy? What's difficult? Improve the things that are difficult, and it's going to make your golf instruction more yielding. You'll get more out of it. It's going to make your practice time more beneficial. So if you enjoyed this or it was helpful, please like, subscribe, share, and let me know what you want to learn next. Thanks.